हेलो गुड मॉर्निंग, मैं सो डॉक्टर आर्यन और आज हम डिस्कस करेंगे मेडिसिन के हेमेटोलॉजी सेक्शन के some important MCQ. A 13-year-old girl is brought to the hospital complaining of fatigue, weakness, pale colored skin and shortness of breath. Left finding कितना and target cell and peripheral blood film. X-ray skull characteristics show here and in the appearance. Poor proper diagnose beta thalassemia measure and the physician advises frequently blood transfusion. Which of the following is the most appropriate drug should be used to prevent the iron overload in the patient? Here the answer is the over diproxamine, because the oral diproxamine during a blood transfusion the body releases more iron and the red cells break down over time. The iron is the hemoglobin is released and the body no natural way to get up the excess of the iron, so extra iron what stored in the body tissue. That's why the patient receiving frequent transfusion are at a risk of the overload. In beta thalassemia, major excess iron excess can occur due to a repeated blood transfusion and massive hemolysis. Next question: a 30-year-old female comes to the hospital for a health care checkup. She is healthy and has no history of serious illness except chronic fatigue. Her menstrual cycle is regular and lasts 4 to 5 days with moderate bleeding. She has no history of blood transfusion, intravenous abuse. Physical examination: vital lab finding RBC count, टोटल lymphocyte कितना है, मेटाजिस्ट 12 है. विच ऑफ द फॉलोइंग इज द मोस्ट प्रोबेबल डायग्नोसिस? Here the most probable diagnosis is the thalassemia minor, the answer, because this asymptomatic patient with decreased MCB and metastasized less than 13 most probable have thalassemia minor. Thalassemia minor, it is what is thalassemia? It is inherited disorder of the blood characteristics by decreasing hemoglobin production. Thalassemia minor patient may not have symptoms and life expectancy is so long. This is a macrocytic anemia, and the thalassemia major patient need a repeated blood transfusion, but thalassemia minor patient do not. Next question: a 90-year-old female comes to the OPD department complaining of chronic fatigue. She has no other history of chronic illness or transfusion history or significant past medical history. Her menstrual cycle regular, last 3 to 5 days, moderate bleeding है. एग्जामिनेशन किए तो वाइटल्स आर नॉर्मल. लैब फाइंडिंग इंक्लूड आरबीसी काउंट ऑफ 4.5 मिलियन, एचबी 9.7, मेटाजिस्टे विलियन. विच ऑफ द फॉलोइंग इनकरेक्ट अबाउट द पेशेंट? द आंसर इज द सीवियर एनीमिया. Because in the patient with chronic fatigue, decreased MCB and metastasized less than 13, most probably thalassemia minor. Thalassemia minor we already talked, inherited disorder है, blood characteristics है, decreased hemoglobin production है, and here the main important by the HB electrophoresis we can done. So generation of HbA2 up to 4 to 8% and MCB range from 55 to 75 FL, and the RBC count is normal in normal or increased, and the peripheral blood smear is mildly abnormal with hypochromic macrocytosis and target cells. Next question: a 28-year female come to the office complaining of the shortness of breath, weakness and fatigue. She has no history of smoking or other illicit substance abuse. Her past medical or family history is insignificant. On physical examination she is anemic. What are normal lab diagnosis? Alpha thalassemia trait. Which of the following found in the patient electrophoresis study? Increased SBF, normal, normal decrease, decrease and normal. So here the answer is the normal HbF and normal HbA2, because the in here the case of the alpha thalassemia trait by genetic deficiency of one or more of the 4 alpha globin genes. It is classified into different types depending on the number of affected genes, like the silence carrier gene, one gene, but deletion typically asymptomatic with normal hematological finding. Alpha thalassemia type 2 gene deletion usually lead to the mild anemia with normal or slightly reduced mean corpuscular volume and mean corpuscular hemoglobin. This is the what in the case of the patient here the described. And in alpha thalassemia there is a decreased production of alpha globin chains, like that. However, this typically does not affect after the composition of HbF fetal hemoglobin or HbA2 minor adult hemoglobin in the blood. These two types of the hemoglobin are composed of the different globulin chains that are not directly depends on the alpha globulin. Therefore, in alpha thalassemia trait hemoglobin on electrophoresis usually show what normal HbF and normal HbA2. And how to differentiate this? Differentiated it from beta thalassemia, where the abnormal HbA2. In beta thalassemia, abnormal HbA2 and HbF levels can be seen due to the changes in the beta globulin production. If we do the hemoglobin electrophoresis, then electrophoresis is a screening test for the hemoglobinopathies. The foundation of this test is the separation of hemoglobin molecules in an electric field principle as a result of variation in total molecular charge. It detects any abnormal type of the hemoglobin while measuring the hemoglobin levels. We can discuss the HB type. नॉर्मल है या सिकल सेल एनीमिया, अल्फा थैलेसीमिया, बीटा थैलेसीमिया। एच बी टाइप अगर एच बी ए है नॉर्मल में 95%, सिकल सेल एनीमिया एब्सेंट, अल्फा नो एंड बीटा थैलेसीमिया में लेस होता है। अगर एच बी एफ है नॉर्मल 2%, या सिकल सेल एनीमिया प्रेजेंट, या नॉर्मल और ईयर इंक्रीज्ड। अगर एच बी ए टू है नॉर्मल 3%, सिकल सेल एनीमिया प्रेजेंट है, अल्फा थैलेसीमिया ईयर नॉर्मल है और ईयर बीटा थैलेसीमिया इंक्रीज्ड। If the screening test for both alpha and beta thalassemia is nestophed like the naked eye, a single tube, red cell osmotic traceability test, and this investigation of choice for both alpha and beta thalassemia in HPLC. What is the HPLC? High performance liquid chromatography. Keep revising. Thank you.